Hi, I'm Dr. Bruce Marshall of the Marshall Clinic. This week's topic is cracks. How do we think about them, what do we do with them, and why are they important? So most commonly, like if you look at this picture here, so you see this tooth has a large old filling in it, amalgam filling, and probably the size of the filling and the material has structurally weakened the tooth such that you get some cracks. And so back here there's actually a crack on the tooth, and a little fracture there, and there's also a crack here, and there's also a couple of cracks here. And so what we do at the Marshall Clinic is we actually track cracks, because it's very common to see cracks in teeth. And one of the hardest things for dentists is to predict what's going to happen with a crack. I often say to patients, cracks are the bane of dentists, because even when we treat them appropriately and carefully and conservatively, the tooth can still have a problem and possibly even be lost. So when we're trying to, that's the reason we get so concerned about cracks, because if you have a crack that runs vertically in the tooth, it can lead to the crack traveling down the root of the tooth and causing eventual loss of the root of the tooth itself. So that's kind of a big deal to us. So when we're looking at cracks on teeth, if I see a crack on a tooth, I typically will find it in an examination, a comprehensive examination or initial examination or even a recall examination, and I'll be telling the person, okay, this tooth has a crack, and then I'll give the crack for that tooth a classification. And so the classification, there's 4 levels of classification. The first level of the crack is I can see it. It's visually present. So I'll say that's a class 1 crack. A class 2 crack is a crack that has stain in it. A class 3 crack is one that when I rub my Explorer back and forth on the edge of it, I can feel. So what we can tell is that those are increasing degrees of the two fragments of the tooth moving apart from one another. A class 4 crack is one you're telling me about it. And so if you're telling me you bite on something, you get a sharp pain upon applying pressure or releasing the pressure, most of the time that means the tooth is flexing and you're getting a flexure phenomenon that's causing movement of fluid in the tubules and causing an action potential and therefore a pain response. So if that's happening, then what we can't tell is where does the crack go. So there's 3 possibilities. If the crack remains in just the enamel and dentin of the tooth, then we can put a crown or a comprehensive restoration on the top of the tooth to help hold the tooth together structurally, and that'll solve the problem 95% of the time. Of the remaining 5%, the crack may go into the pulp of the tooth. So this is why sometimes people will have a hot and cold sensitivity and or pain with the tooth that's ongoing, dull aches, that type of thing. And if that's happening, sometimes the tooth will need a root canal. And so of that 5%, if you do a root canal on tooth, you put a crown to help hold the tooth together, you put, and then you still have discomfort when biting on the tooth or to hot and cold after 3 months, then we'll recommend doing a root canal. We take the nerve out of the tooth, and that'll solve the problem of that group about 95% of the time. So for the remaining percentage of teeth, which is a very small percentage, the crack can go down the root of the tooth. And so that even though you've done the root canal, you've done the crown on the tooth could still experience some sensation when you bite on it. And so most of the time this is a very muted sensation, so people have a choice of choosing to live with it or remove the tooth and replace it with an implant or a bridge or something like that. So if we get to that stage with a cracked tooth, often the prognosis is very guarded for the tooth and we kind of expect you're going to lose the tooth long term. But the timing about when you do that, it gives you some space to figure that out. So normally the first treatment for a cracked tooth will be some type of provisional. I love to do provisional crowns on teeth because then you haven't made a big investment in replacing the tooth, and we don't know if it's sort of one of those bad teeth that's going to go past the point of no return. So we'll put a provisional on it. We'll see if all the symptoms disappear within 3 months. If they do, awesome. We can do a definitive crown, and the likelihood is you'll be just fine with that tooth indefinitely. If there's still symptoms, we do the root canal, should remove the rest of the symptoms and be fine, and then you're okay to do the crown after that, and away you go. And that typically is the way we manage cracked teeth. So if you have some cracks in your teeth, we also want to start thinking about why you have cracks in your teeth. Again, if you look at the picture here, this tooth has got lots of reasons for why it might have a crack. Big old amalgam filling, on the, this is his lower left first molar, which is a tooth that's been there the longest. So it's probably had the most function on it, the most abuse, all that sort of thing. So it's not surprising that a tooth like that might have some cracks in them. But things to avoid getting cracks on your teeth are doing like chewing on really hard things. Chewing ice cubes could be one of the worst things for making cracks in teeth. Chewing ice cubes can lead to cracks in perfectly virgin teeth, so teeth that haven't been structurally weakened by restorative procedures or materials, and you can completely destroy a tooth that way. So just chew normal things, be gentle with your teeth, take good care of them. I hope you never have any cracks in your teeth, but if you do, make sure that people are monitoring them for you, and that you get on them if they're progressing. So thanks for listening. Bye for now. We'll see you next time.